Good afternoon. Again, today we see an increase in cases in the country of COVID-19, well over 2,000 cases and 25 deaths. Approximately 6% of those cases have been hospitalized in this country, 2% in the intensive care units. Here in Prince Edward Island, we still have 3 confirmed positive cases. And almost at risk of sounding like a broken record, I need to talk again about really important messages about social distancing and self-isolation. We need to continue to reinforce the importance of self-isolation and social distancing, but I think I need to be clear about the difference. And it's not easy. These are new terms and new behaviors for all of us. Self-isolation applies to anyone who has traveled outside of Prince Edward Island, whether it's outside the country or within Canada. That means for 14 days, you are staying in your home. The only reason you would leave is to get a bit of fresh air, and you should be practicing social distancing while outside. Social distancing is for all islanders who have not traveled outside of the province. And that means maintaining that 2-meter distance with others. And that's really partly, it's because the virus is spread by droplets, and you do not want to be close to someone if they cough. It's also really important to continue to wash our hands for 20 seconds, not touch your face. Try to keep your hands away from your face if you're outside the house. Because that droplet spread means that the virus may live on doorknobs, on countertops and surfaces, and it's really important that if you're touching any of those surfaces, you don't touch your face and infect yourself, and as soon as you can, wash your hands. And if you're doing social distancing, that means still staying home as much as possible. Absolutely, one person in the family can go out and get groceries or pick up a prescription, but while you're doing so, maintaining that social distance. It is in doing these kind of social distancing, self-isolation, that it will help us flatten the curve. And we've talked about it before, but I'd like to mention it again. The flattening of the curve will help us slow the spread of COVID-19. And when you have an outbreak of an infectious disease, and in this case we have a pandemic, it goes in terms of a peak of intensity and then comes down. And the height of the curve represents the maximum number of cases from the infection. And that number could be well above what our healthcare system is able to cope with if we do not try to flatten that curve. I do expect that here in P.E.I. we will soon see a rise in cases and an increase in hospitalizations. So that is why it is important to take measures right now that all of us have been discussing, and important to continue to reinforce that before we see that large increase in cases, we do everything we can to flatten the curve. In terms of testing, early this morning there were 416 tests, with a number of tests being planned for this morning. We are still waiting for test results to come back, and we have our 3 positive cases. It's hard for all of us as we wait for testing results to come back, and as I've mentioned before, we are hoping that before too long we'll be able to do our testing in our own province, so that will make the turnaround time for the test results faster. In terms of 811, those who've traveled outside of P.E.I. and are experiencing symptoms of cough, fever, difficulty breathing, of course, should call 811, and that's including whether you traveled outside of the country or somewhere else in the outside of the province. 811 has enhanced their technology, added more lines and staff, and last night they were able to report they have significantly reduced their wait times, and I want to thank Islanders for their patience. This is a follow-up really from yesterday. I want to be clear, playgrounds are now closed. And this is because it's very difficult to maintain social distancing with a group of children in these spaces, but also because the cleanliness of playground equipment cannot be guaranteed. Also, any playgrounds connected to parks will be closed. For example, Bonsha Park will remain open, but the playground associated with it will be closed. Community fundraisers and lotteries should only be done online. Those who are going to convenience stores should remember to come in, get what they need, one person, and then leave. I know it isn't easy for any of us, but working together while we stay apart is the best way we can prepare for the weeks ahead. I want to thank all our essential workers for their continued service on the front lines now and in the weeks ahead. I want to particularly thank our healthcare workers for navigating this new reality every day and how they work with their patients. I want to thank Islanders for their staying home and for finding new ways to stay connected and for looking out for one another. The time to act is now, but acting requires us to stop. Stop going out, stop socializing in person, and most importantly, stop or at least slow down the spread of this virus. Bonjour. Le taux de cas COVID-19 continue à augmenter à travers le pays. Il y a maintenant plus de 2000 cas et 25 morts au Canada. Ici à Lille, il y a toujours 3 cas. J'en parle tous les jours. La distance sociale et l'auto-isolement. Je vais clarifier de nouveau aujourd'hui. L'auto-isolement, c'est pour les gens qui ont voyagé à l'extérieur de notre province, que ce soit ailleurs, au Canada ou à l'étranger. Ça veut dire 14 jours chez toi. Si vous sortez, c'est pour prendre de l'air et vous devriez pratiquer la distance sociale. La distance sociale, c'est pour les insulaires qui n'ont pas voyagé à l'extérieur de notre province. Vous devriez rester chez vous autant que possible. Faites vos courses, mais respectez les 2 mètres. Et lavez les mains. Lavez les mains. Et ne touche pas votre visage. Je vais expliquer davantage comment la distance sociale et l'auto-isolement aident à aplatir la courbe. Et on parle déjà, mais je mentionne encore aujourd'hui. Lors d'une épidémie, il y a une période qui augmente de plus en plus. Ensuite, un point culminant de cette intensification, ensuite une baisse. Là, autour de la courbe, c'est le taux maximum de cas de la maladie et ce chiffre peut dépasser les capacités de notre système de santé. Je m'attends à voir une augmentation des cas à COVID-19 et de gens à l'hôpital bientôt ici à l'île Prince-Édouard. Alors, c'est important que nous prenions les mesures nécessaires pour aplatir la courbe pour minimiser cette hausse. Le but, c'est de ralentir la propagation de COVID-19, de prévenir autant que possible le point culminant pour ne pas surcharger notre système de santé. Depuis ce matin, on a plus de 400 tests réalisés. Il y en a plusieurs qui vont être testés ce matin. On attend plusieurs résultats et j'espère d'en recevoir plus tard ce soir ou demain matin. Si vous avez voyagé à l'extérieur de la province et vous avez des symptômes comme une toux, la fièvre ou essoufflement, appelez le 811. Et maintenant, il n'y a plus de personnel et des améliorations techniques de 811 qui vont aider avec les temps d'attente. Et merci pour votre patience. Je vais mentionner les terrains de jeu sont maintenant fermés et c'est parce que ce n'est pas possible de garantir que les installations sont propres comme il faut. C'est aussi difficile de maintenir les 2 mètres entre les enfants parce qu'ils veulent jouer ensemble. Je sais que ce n'est pas facile, mais si en étant solidaires, en gardant nos distances, c'est la meilleure façon de faire, de passer à travers les semaines qui suivent. Un grand merci aux travailleurs essentiels de première ligne pour leur travail continu. Et merci au personnel de santé qui s'adapte à toute cette nouveauté. Et merci aux insulaires qui restent chez eux, qui trouvent de nouvelles façons pour échanger et pour s'appuyer les uns les autres. Nous allons passer à travers ça ensemble. Merci. Open it for questions.
Media, Wayne Thibodeau from CBC.
Dr. Morrison, Wayne Thibodeau here from CBC. I just have a question with regards to the enforcement procedures that were announced yesterday. We're hearing from some frontline police officers who still don't seem to see what their role is going to be. So can you give us a sense, are they going to be going door to door? Are they going to be responding to the concerns of the public health officials? And if so, then how does that literally work on the front lines?
Well, Wayne, that's exactly the conversations that we are having. We had correspondence out through EMO and the police services last evening, and there was a follow-up meeting with my office and the police services just before lunch, and discussing exactly that. And our expectation is that, and Minister Thompson announced that last night, if a concern comes, is called into us through the 1-800 line, we will reach out and we will initially have that conversation. And the expectation really is around the police services maybe there to help us if we feel that we need it. And I think that is partly that process that we're working out. And I expect islanders and visitors who are here in P.E.I., they really want to do the right thing. They do not want to get sick themselves. They don't want their families to get sick, and they don't want the community to get sick. And I think we've said it yesterday, and I think it's important to mention that it's a balanced use of authority. And the first call is about making sure people understand what they're supposed to do, and then maybe having to have the police involved in a warning. And those are, I think, being worked out literally today. And it will be important to make sure we have that process down, especially if we have more cases. And for instance, a case of COVID-19 did not want to self-isolate, and we needed some assistance in making sure they stayed inside, for instance.
And just to follow up to that, so I know the new rules in terms of this have only come into place yesterday, but have you had to make those calls yet from people who have not been following the rules? And what has that response been back when you've had to reach out, or someone in your office has had to reach out who may not have been following the rules of self-isolation?
Well, I mean, for a number of days we've been receiving calls, so not just since yesterday, of concerns from employees who have concerns in their place of employment, and we had already started reaching out to those particular businesses and addressing those concerns, and we will be continuing to do so. And that's one example. And for the most part, so far it has been well received. There's only been one situation that was brought to my attention that there was a little reluctance, but a subsequent firm voice conversation happened, and so that was resolved. But I anticipate more, and again, Wayne, we're trying to make sure we get those details solidified today, and in anticipation of more concerns coming through. And remembering that social distancing, and that's why it's important to understand the difference between social distancing and self-isolating. But we really know that some of that risk of people returning from outside the province and outside the country could potentially put islanders at risk, and that's why we're focusing on that.
Junipe, the Guardian.
Hi, Stu Neepy here. Dr. Morrison, I just had a question, I guess, about workplaces that are still operating, particularly, I guess, in the construction industry. Now, construction isn't sort of listed as an essential service, but I understand there are several job sites that are still, ongoing. So I guess first off, just for clarity's sake, like, should construction job sites still be operating? And number two, what guidelines should be followed in terms of social distancing and sanitation on these sites?
Stu, you always have good questions, and so that has been certainly raised with us in terms of the construction, questions around construction and what is essential and non-essential. And we've tried to give some examples where the construction is critical to the infrastructure of our province that would be considered essential. There are some construction projects that are currently underway that for all sorts of safety issues might need to be completed. For instance, if and also if a wharf needed to be repaired, and or someone's roof falls in. There's all sorts of a range of reasons that construction would need to occur. Certainly not a new home build to start, and so. It is the social distancing messaging, the issues around washing your hands or having alcohol-based sanitizer are really important. And my understanding is that also there was an increase in hand sanitizers distributed to a number of the construction sites, for instance. So it is it's certainly a challenge, and trying to balance out the work that needs to be done. But construction industry or any business trying to look at how can they keep their staff and their employees safe, and yet still, if it's an essential build, how do you do that? So it involves conversations and a risk assessment, and sometimes a follow-up discussion with a particular construction company.
Okay, and just as a follow-up, we had an op-ed that sort of raised the issue of only having hand sanitizer on work sites as opposed to an actual water washing station. So again, is the expectation that there be actual kind of water washing stations provided at these job sites?
Well, certainly warm water and soap is our preferred hand washing recommendation, but we always say that if warm water and soap is not available, an alcohol-based hand sanitizer with a minimum of 60% alcohol, preferred 70%, should be available, and that's and that has to be the case in certain areas.
Sean McDougall, The Graphic.
Hi, Dr. Morrison. You said over the weekend that you received 76 calls from individuals looking to come out of retirement to help with health P.E.I. in this time. And I was just wondering, what is the number of those retired professionals that are now relicensed to work for the island?
So a good question. I don't have that information in front of me today, but we should be able to provide that tomorrow. And I think Marion Dowling will be here tomorrow as well, and she will likely have that information.
Okay, and just to follow up on that, are health professionals on the island being screened or tested at all for the virus, given that they're sort of on the front lines of things?
So, healthcare workers who have new onset of cough, and fever, whether or not they've traveled. So that's regardless of if they have traveled outside the province or outside the country, are now being screened for testing if they have new symptoms. So that is the case, and I think that will be important. They are a priority certainly to make sure that they do not have COVID-19 because they would not want to inadvertently transmit COVID-19 to their vulnerable patients.
Okay, thank you.
François-Pierre Dufour, Radio-Canada.
Oui, bonjour, Dr. Morrison, François-Pierre Dufour de Radio-Canada. À la lumière de ce que vous dites aujourd'hui, il y a encore beaucoup d'insulaires qui ont de la misère à faire la différence entre l'isolement et l'éloignement, la distance sociale. Pourquoi, selon vous, cette nuance-là est si difficile que ça à faire comprendre dans la population?
OK. J'ai un peu de difficulté à t'entendre. Je m'excuse. Est-ce que vous pouvez répéter juste la dernière partie de la question, s'il vous plaît?
Oui, je vous demandais, est-ce que vous m'entendez bien?
Assez bien. Je pense que c'était à propos de la distance sociale et l'auto-isolement.
Oui, il y a une différence entre les deux. Et à la lumière de ce que vous dites aujourd'hui, clairement, les insulaires ne comprennent pas tous la différence entre les deux. Pourquoi, selon vous, est-ce que ce message-là passe aussi difficilement après déjà 2 semaines de crise?
OK. Je m'excuse. Peut-être je ne comprends pas la dernière partie, mais c'est l'auto-isolement, c'est pour les gens qui ont voyagé à l'extérieur de notre province et n'importe quoi si sont ailleurs au Canada ou à l'étranger. Et puis la distance sociale et la distance qu'il faut garder entre les gens, au moins de 2 mètres. Pour les deux, c'est important pour qu'on réduise, si on fait ça bien, on va avoir la chance de réduire le nombre de cas ici à l'île du Prince-Édouard. J'ai entendu quelque chose à peu près à partir de 200 degrés, mais j'ai pas compris, je m'excuse.
Ma question essentiellement, c'est pourquoi la différence entre les deux est si difficile que ça à comprendre pour beaucoup d'insulaires?
C'est difficile de comprendre les deux parce que c'est des termes nouveaux. On change qu'est-ce qu'on fait. Comme la monde, ça fonctionne différent, d'une façon différente maintenant qu'il y a 2 semaines. Alors, je comprends que c'est difficile. C'est difficile pour ma famille chez moi, pour tous les gens qui travaillent, qui sont les travaux essentiels. Et puis, et c'est difficile de faire quelque chose quand vous sentez bien. Vous ne sentez pas malade, mais c'est maintenant que c'est tellement important à la faire et c'est pour nous protéger, mais en particulier de protéger les gens qui sont plus âgés ou ont des maladies chroniques.
Laurent Rigaud, La Voix acadienne.
Bonjour, Dr. Morrison, Laurent Rigaud de La Voix acadienne. Vous avez brièvement dit en anglais quelque chose à propos du virus qui survit sur des surfaces et que quand on touchait quelque chose, il fallait faire attention à bien se laver les mains avant de toucher le visage. Est-ce que vous pouvez réexpliquer ça en français, s'il vous plaît?
Je vais essayer. Alors, le virus peut vivre sur les surfaces de plusieurs heures jusqu'à plusieurs jours. Alors, si vous touchez les portes, les comptoirs, il faut vraiment être certain que vous lavez les mains après, mais et surtout de ne pas toucher ton visage parce que vous pouvez transmettre le virus du surface jusqu'au si vous touchez les mains au visage. Alors c'est parce que quelqu'un a peut-être toussé et le virus est maintenant sur les surfaces et il ne faut pas vous doit faire tout ce que vous pouvez pour s'assurer que ça ne va pas être transmettre ou si vous, et vous ne voulez pas transmettre à quelqu'un d'autre. Alors, juste laver les mains, de ne pas toucher vos visages, après toucher les surfaces communes. Et c'est important de faire tout le temps, mais particulièrement avec ce COVID-19. Parce que c'est un virus qui est nouveau. On n'a pas d'immunité pour nous protéger.
Et juste pour rebondir sur votre réponse, est-ce qu'il y a des précautions particulières à prendre quand on fait l'épicerie et qu'on revient avec des choses qu'on achète au supermarché?
Alors, si vous allez au supermarché pour chercher quelque chose, il faut, en retournant chez vous, il faut laver les mains parce que vous êtes en train de toucher toutes sortes de choses là-bas et laver les mains avant de manger, avant d'ouvrir les boîtes et de faire ça certainement avant de toucher la nourriture.
Carrie McLeod, Ocean 100.
Hi, Dr. Morrison. A couple of questions just surrounding that 14-day self-isolation period. There seems to be some confusion out there as to just exactly what should be happening with the families and others that live with somebody that has to self-isolate after returning from travel for 14 days. I know we've had many messages from some listeners wondering, is it okay for their children or their spouse to be working outside the home?
Carolyn, I'm so glad you asked that question because I had meant to address that. When you're self-isolating and maybe you've come back from a trip, but your family wasn't with you, you are required to self-isolate. Now, self-isolating at the house, that means you need to be basically living in a separate bedroom. You don't share a bedroom. You don't use the same utensils. You are able to be very separate in the house. That is not possible for everyone. So if you have small children, you can't self-isolate from them. So that means the whole family would have to be, the children would have to be self-isolated with you. If you live 7 people in a 2-bedroom apartment, there's no room to actually be able to self-isolate. So that is a different circumstance. So the self-isolation for people who really can do it, then it's fine for the partner to continue to work until, in case, unless the person who's self-isolating develops any symptoms. And so Carolyn, and to that point, what we've done, and we talked about it this morning with our team, trying to put some language up on our website that will help articulate exactly that. Because I do think it's confusing and it's hard. It's not typically what we do is sort of isolate ourselves from other people in our family. And so I think we're going to try to make sure that we get that question and try to answer it and try to clarify it as well on our language on the website by later today for exactly why you raised it.
And do we know for certain that somebody that is self-isolating, do we know for certain that after that 14-day period that they are not contagious?
So, I mean, we have a lot of evidence because of so many cases in the world, over 300,000 cases. So what they know about this virus, the onset after you've been exposed, the typical onset of symptoms would be sort of 2 days up to 12.8 days is the longest. So, and that's why it's been extended to 14 days. So that's why the 14-day period, if you have to make sure that you are self-isolating for that period of time to make sure that we're capturing any kind of symptoms that may develop during that period of time. The average onset of symptoms is around 5 to 6 days, but it has ranged from 2 to up to 12.8 days.
Dr. Morrison, is it possible, have we seen anywhere else worldwide that a person can actually catch the virus more than once?
So it's another good question. So I think they are learning more about it. They actually are, and of course it's early months of this virus in the world, but there may be immunity for those who've had the virus and for a period of time. And I think they're still trying to do research on how long that immunity will protect people. So it's possible, but at this point in time, if you get the virus, it's showing that there may be some immunity that lasts, and I think research is ongoing about how long that immunity can last.
Thank you.
Merci tout le monde. Thank you, everyone.
Thank you.